Good afternoon. Good afternoon. It's Wednesday, April 17th, and this is Dr. Velma Scanterbury coming to you live from the Dialysis Patient Citizens Educational Center. And today, this is our session on Ask the Doctor. And I hope many of you will join. It's a beautiful day. I am actually on a vacation business. And so it's very hot here where I am. So I hope that many of you will join. So again, as we wait for others to join in, this is Dialysis Patient Citizens Educational Center. Ask the Doctor, today being Wednesday, April 17th. And good afternoon, Yolanda. So nice to see you. This is Dr. Scanterbury, starting Dialysis Patient Citizens Educational Center here on Ask the Doctor. And today is Wednesday, April 17th, and April is Donate Life Month, and which is celebrated by the National Kidney Foundation, Gift of Life, Donate Life America. All these various organizations are really focusing on how do we get more donors and how do we get more people to really put on their radar the need to talk about organ donation, talk about it with their family, think about what you can do to influence others to consider being an organ donor. Certainly for many people, they are agreeable, but there's still about 20%, well, probably in most states it's slightly over, some states it's still 45%. In Pennsylvania, here in Delaware it's sort of like 55 to 60%, but it is important to let people realize that, you can't take it with you. And so while we are advocating deceased organ donation, we also need to talk about living donation. Living donation in terms of letting people being aware that if they have two kidneys, that they can donate one to help someone else. And that's so very important. Many people are afraid of asking their families. They're afraid of having that discussion. But it is not on the radar for a lot of people. And this is an avenue that you can use your church, your community center, any place that you gather to be able to say, let's talk about organ donation. How can you help others? Because when we pass from this earthly body, from dust we came, and to dust we will return. And what better way to tell others about the need for organ donation? So many of you who are on here may already know about it, but you may also be able to use your knowledge and understanding about donation to help others, to start that conversation. Next time you have a family gathering, next time you have an opportunity to play bridge or play cards, or even at your church, maybe this is the month you begin to say to your place of worship, perhaps we can have a session, or you can invite the local organ procurement organization to come to your health ministry or whatever organization you may have to say this others in, so that they can talk about the need for organ donation. And not only so many people on dialysis, how many people die every day waiting for an organ, and what can we do to spread the word to others? Sorry about that, got some internet issues. So one of the things that you can be an advocate, and it's so important to be an advocate. If you're on dialysis in need of an organ and you are desperately trying to find a donor, sometimes it's an easier route if you have an advocate, and that advocate can really do the work on your behalf. You may feel uneasy asking others to talk about being a living donor, but that advocate, that is the person who is going to represent you, they can ask the tough questions. They can say, even in terms of the things that you may be embarrassed about, sometimes we say, figure out who is your network and how many networks do you have. Is it your family network? Is it your bridge club network? Is it your community center network? Is it your place of worship network? Is it your book club network? And how can you pass the word out, even by sending a note of saying, I'm reaching out to those around me. I've been on that, congratulations to me. I've made it to my 3rd, 4th, 5th, 10th year of dialysis, and I'm really, I'm thanking God for the ability to survive and to still be here, but I'm still in need, and I'm still praying for a donor. Just want to be able to educate those communities out there to say, please sign your organ donor card. Think about how you, at the end of your life, may be able to save someone else from being, save someone else from dying by providing them with an organ. And we've had so many what we call altruistic donors, our non-directed donors, who directed donation, where folks are saying, well, my family have passed, and I agreed to organ donation, and I want one of these kidneys to be donated to Nancy, who I know is on dialysis in Baltimore. And they don't even have to be in the same city. And so that organ procurement agency will then find out about Nancy on dialysis. Is Nancy listed for a transplant? And before that directed donation can occur, we will check to see whether Nancy is compatible with that donor that the family would like for that direct donation to be passed on to. And unfortunately, sometimes they're not compatible, and therefore it can't happen. Or the family may think that Nancy is on dialysis and is on the transplant list, and they realize after they call that Nancy has not been added to the transplant list yet. So you can't get a kidney unless through direct donation. In case someone of your family members, friends, relatives, co-workers wants to donate to you, they have to be listed for the transplant. And in one situation, a patient that I knew was almost ready to be listed, so we went ahead and activated her so she can get that deceased direct donor offer. So that's why it's important to do what you need to do to go ahead and get on the list. Get on the list so you can wait, even if you're not quite ready for transplant, but you're building up that time. But you want to be able to say, if someone that I know, friend, relatives, even someone who I don't know wants to make that organ donation through direct donation, then you're ready to go and you're on the list. So how do you get on the list? You want to be able to if you're on dialysis or you have that 20% or less of kidney function, you don't have to be on dialysis, but you can initiate that workup by calling a transplant center, asking your dialysis unit to make a referral to the transplant center, and get your workup started. Sorry, I was frozen there for a bit, but I hope you can hear me now. And so you have to start that workup to get on the list. It means having medical clearance, making sure you have that financial clearance, making sure that you don't have any cancers. And so the medical clearance is really about making sure that you will be able to survive the transplant and live past 3 to 5 years. We don't want you to die of something else that we didn't recognize. And so that's the work of making sure your insurance, you have the right insurance to cover the medicines, and you want to really go through the work at the transplant center. There's a lot of education. So for that person who it was Ralph, you want to get that information of how you can get on the transplant list. And so you can be on many different transplant lists, but as long as they're not in the same area. So if you live in Baltimore, Maryland, you can be on that transplant list in Baltimore, Maryland. But you can also be on the transplant list in Delaware, which is this right close within, as long as you can travel to that area. Many people live in New York, and the waiting time in New York for deceased donation is about 10 to 12 years. And so if you have relatives or have the ability to say, you know what, I want to be in the list in over in New Jersey or Pennsylvania, which is right across from New Jersey, and I'm willing to stay in that area when I get transplanted, then I'm going to put myself on that list in that other, and in many different baskets as possible, so that I may get called for kidney. So you don't want to, if you're able to travel and get there within a reasonable time, within 2 to 3 hours, if they call you for a transplant. And these days, most people are aware of the fact that when I call or know that there's a person needing a transplant, they're actually contacted long before the kidney is removed from the body. So there's a little bit of time to even go to your dialysis unit, get dialyzed, and get to the transplant center. There's a lot of pre-warning, and the list is run long before the kidneys are available, because they're often working with a team of people who may be there for the kidney, the liver, the heart, and that takes time. So if you're able to get on one or more transplant lists, then that's a good thing. So I want to say, for those of you who have joined, I'm Dr. Scanterbury. I am today's Ask the Doctor, and welcome to the Dialysis Patient Citizens Educational Center Live. And this is the platform for you to ask questions and for me to answer as many as possible that I can. And Redrick Taylor, welcome. This is your first time in this meeting. Welcome. Tell those of others who may want to have questions that they may not be able to find answers for while they're on the dialysis team or the nephrologist or wherever, even if you had a transplant. And Lisa's, after 12 years of dialysis, she got a transplant and wanted to learn more about the process. So thank you, Lisa, for being here. Absolutely, absolutely. And Yolanda, you bring in energy from New York City. Thank you so much. So we really, Nancy asked, what's your thoughts about the patient who got a kidney from a pig? Well, certainly you have to remember that there is genetic engineering, and the goal, certainly, remember the FDA is only doing this on a one-off basis based on the need. And this was a patient who had failed all dialysis access and did not have a way to be dialyzed. And so he was granted permission for this experimental process to occur. And these pigs are manipulated genetically so that the genes that are most prominently affect rejection are removed, and recognition and some of the human genome is placed. And so these pigs are altered genetically to not recognize for our body to not recognize that kidney, which is genetically modified to have human components and as well, to be rejected. And so that's a phenomenal thing to occur, because you can have there are many different pig farms that are across the country. There's some in Alabama, there's some in Maryland. Surprised that Boston was able to get theirs out there first. But there are many transplant centers who have these genetically engineered pigs. And if this is made available, this will be a major breakthrough for many patients waiting on dialysis. Unfortunately, it takes a while, and it will take a few years to allow for this to be approved. And then once it's approved to be and no longer experimental, certainly the average person will likely not be able to afford this because it's not covered by insurance. So it either has to be covered by the hospital as part of their experimental process. When it's approved, it then has to be approved by Medicare, which takes another hurdle in order to become available for those who are on dialysis. And certainly the cost of that kidney in terms of for every kidney transplant that's performed, there's an acquisition cost. what will that cost to the patient? Will that be higher than the human kidney acquisition? Because there's a whole lot of genetic engineering that goes into producing these pigs that are functional to the point where our bodies will not reject them or see them, because it is considered what we call xenotransplantation, from one species to another species. So that becomes a very important thing. So thank you for that question. There's more to come. The goal will be to see that as a xenotransplant of organ from another species, how long would it take? The medications are different. This man received different medications that are currently being used for transplant. Anti-rejection medicines. So all that has to take into consideration. It's very expensive procedure right now, but approval, medications being cleared by Medicare. I'm hoping that, the question is, how many years will it take for this to be made available to the average patient on dialysis? But very exciting stuff to know that. Over 25 years ago, when I was still in Pittsburgh, there was initial work of using pigs for transplantation right after we failed with the baboons. And these pig farms have been really, over the past 25, 30 years, improving their production of generating pigs to be able to use these kidneys for transplantation and not have them rejected. So certainly the means is there. The goal is to develop better medications to overcome this process of taking a pig into a human. But this stuff is phenomenal work, and probably will be breakthrough for many, many, many patients to come. So thank you so much. There was a question earlier, I hope I don't miss it, about transplantation. How long does a kidney last? And you have to remember, I tell patients, kidneys are like cars, in terms of you can have a new car and have it last 20, 25 years. I know one couple people who have their cars for 30 years. But that's very few. Same thing with those with kidneys. And you can have a new car, which means a healthy, good kidney, and have it only last 5 years or less. And that's because things happen. You have, like a car, you can have an accident, the engine, things go wrong, it was a lemon. And so with kidneys, your body, even with a good kidney, you may experience rejection that was not predictable with the medications given. But you can also get, so the younger the kidney, the less wear and tear on that kidney. And so younger kidneys will last many years compared to a kidney from someone in their 60s or 70s, because age affects the kidney. But if you're on dialysis, certainly kidney transplant is better for you with any kidney. And certainly the goal is making sure that's a kidney that will work. So deceased organ transplants are generally will last less time than a living donor, because I'm working up a living donor, and I'm going to make sure that living donor doesn't have diabetes. That's a no-no. Used to say it doesn't have hypertension, but now we're transplanting kidneys from relatives, immediate relatives who may have hypertension, but only on one medicine, at the most 2, because hypertension, and certainly a big question mark if that's an African American, because that will put that person likely more at risk for kidney disease down the line. So that's a question mark there. And certainly the goal is that you want to have that donor goes through a battery of tests to make sure their kidneys are perfect. They at least have an EGFR of 85, 90% or greater, because you want to be able to take that kidney out and leave them with remaining function. So living donor kidney usually is pristine, no underlying issues, while a deceased donor, and so those will last longer if there's no overwhelming rejection, if you take care of them and there are no issues. But if you have a deceased donor kidney, you have to remember that deceased donor might have high blood pressure, might have diabetes. We look to make sure they don't have kidney stones. and the story is only as good as what the family is told to you. So sometimes there's some hidden stuff, not hidden stuff, but there's some information of the past medical history that we may not have obtained that may impact that kidney long term. So we may not know, or the relatives may say, well, they had high blood pressure, but I think it's likely 10 years, when it turns out that when we biopsy that deceased donor kidney, it's pretty scarred from high blood pressure. And so some of those kidneys we will not use because the disease or the family really has no idea how long the medical condition was. And so for deceased donor kidneys, we have to oftentimes biopsy them to make sure that the underlying disease hasn't affected the kidney transplant. Those can still be used, but we know we often reserve those with a question amount of scarring for patients who are older. If we say this kidney may only last 5 years, or under 5 years, then that certainly is good enough for someone who are in their 70s. But we would not give that kidney to someone who's in their 30s or 40s, because they really need a healthier kidney to get them through 10, 12, 15 years if possible. And you have to know that this is just a projection, because oftentimes in the donor, the creatinine is normal, and you're not suspecting kidney disease, but we know if there's underlying hypertension or diabetes, we're going to biopsy that kidney, because the actual creatinine is not a good reflection of the scar tissue in that kidney, which will in overall affect the longevity of that kidney. So how long a kidney lasts depends on the donor factors as well as the recipient factors. So you want to make sure you're compliant with your medication, that you're taking your medication. You don't miss your doses. I tell folks that when we're feeling better, we tend to forget our medications. If we're sick, you remember them. So when you forget your medicine, I tell your anti-rejection medicine acts as a cloak. It cloaks your kidney so that as your white blood cells are running around your body, it doesn't see that kidney as foreign. You miss a medicine today and you miss some tomorrow, and now you got a weakened system that now your white cells are saying, I see something that I didn't see yesterday. And you set the stage for rejection because you weaken that barrier by missing those medications. So the reason why we check levels is that we want to make sure that you maintain a constant barrier between your white cells and your kidney, so that there's not that recognition that's occurring. And so you wipe out a certain amount of your white blood cells that causes the recognition. And now they say, okay, now I'm going to attack and figure out why this foreign substance, which is your kidney, is there. Lisa asks, is there a list for people using the kidney or mechanical organ kidney? Not yet. Generally with those centers, because this is still being approved on a one-on-one basis, I'm sure that at those larger centers, whether it's University of Birmingham or in Boston, I'm sure they have a few selected patients reserved for those transplants to occur. But I don't think that as a general list, because you have to be, I'm sure there's criteria for making sure that that you understand the risk and benefits and the potential complications, which is much more rejection. One of the things that we do with these kidneys, these pigs, is that they keep them in isolation to make sure they do not contract any unknown viruses or bacteria that may come to the surface after the transplant, because that is the issue with crossing species, is that certain viruses they can live with and they're not detrimental to their health, but you transfer them to a human and suddenly you have a condition that is untreatable. So these animals are kept in a sterile environment so that there's no cross-contamination with others, with viruses and bacteria. Can sinusitis cause kidney failure? Sinusitis is really, you have a sinus infection in your, whether it's your frontal, maxillary, temporal sinuses, all those. And so can it cause kidney failure? Not directly. It all depends on what the organism is. Certainly there are some strep infections that can affect that can lead to glomerulonephritis. So you want, depending on the organism that's causing the sinusitis. You also have to look at how the person is treated for the sinusitis. It can also be the antibiotics. Is the antibiotics hard on your kidneys? And often when you talk about kidney failure, as opposed to kidney damage, you have to say, did this person already have underlying kidney damage? And the fact of dehydration, antibiotics, the infection, all coupled to cause worsening of your kidney function that now took you from a stage 3B or 4A to a 5. It's really about analyzing the situation. But sinusitis in itself does not cause kidney failure. There's so many people have sinusitis. It will be really a lot of people with kidney failure. So it's either in the treatment, the organism, and there's a lot more that would need to be understood before you could actually extrapolate that one caused the other. So thank you very much. We've got a few minutes left, but I want to welcome all of you who joined here today on this Ask the Doctor session on dialysis patient citizens. Remember, if you are not a member or have signed up on the website, please go to Dialysis Patient Citizen Educational Center, sign up to learn more information, invite others who are maybe even caretakers of dialysis patients, caretakers of transplant patients, so that you may be armed with information that can help you. How to eat better. Our nutrition is really important when it comes to keeping healthy, preventing heart disease. There are great recipes on the website in terms of, especially now that summer is coming, that really allows you to focus on better eating. I think there's a nutritional session coming up. You will get information on how you can tune into different webinars, learn information on advocacy, talking to transplant in terms of learning more information, how to get on the list, how to advocate for yourself, how to advocate for others, how to do better on dialysis and increase your survival overall. And so I want to invite all of you to, if you're already a member of and subscribed to the Dialysis Patient Citizens Education Center newsletter, invite someone else to join. Tell them to go to the website and add that information. Tamara says she was diagnosed with stage 5 kidney disease in May of 2023. And I hope that you are on the list, or at least being worked up to get on the transplant list. It's been a year, and then you want to accumulate that time and you want to stay healthy. And so that becomes very important. So congratulations on your transplant to Lisa Baxter, and really pass this information on to other people. Let's see, did I miss any questions? We got about 2 minutes left, but like I said, this is there's also some information on polycystic kidney disease. There's a webinar. There's on the DPC educational site. There's vast amount of information that can keep you knowledgeable, and knowledge is key. If you have questions, learn to ask questions. Ask questions of your doctors. Ask questions of your dialysis team. Learn how to be a better patient. And the more you ask, the more knowledge. And what is this medicine for? How's my phosphorus doing? Am I anemic? And do I need more Epogen? I'm feeling tired. Why am if I'm on dialysis, why are my legs swollen? That's the key question. And so you should be dialyzing off your extra fluid. If you're not dialyzing your extra fluid and your legs are swollen, that's a question for your doctor. And so you want to really look at your process and learn how to advocate for yourself. Don't take things for granted. Don't assume that everyone has your best interests at heart. So it is 1 o'clock. I appreciate you guys being here. Thank you for coming on. Next time, bring a friend with you or invite another friend to listen so that they can learn more and that they can understand how they can be an advocate for better health. So check out the website. Check out the ways to, the recipes. There's a broccoli recipe on there. And be well, and you take care. Have a great day.